Good morning for everyone. Thank you again that you come in fourth day of our conference. And we appreciate that you're so interested in the bioregenerative medicine. And I try in my lecture today to show you more about the urolithiasis. As far as our general common seminar is about the interrelation, some multiple pathology with a bone tissue. So I would like to share how we can prevent both changes in kidney to prevent the urolithiasis as well as prevent some bone tissue deterioration. So also my material, my lecture only for education purposes. And let's move to the objectives. So objectives, my lecture will be about the key mechanism of kidney health. Also about the main risk of kidney stone disease. And what is the solution? Especially in case when we have both. So we have some bone deterioration and we have some reason or already patient has some diseases like urolithiasis. So urolithiasis a really big problem, and we can expect it continue rise in the morbidity of kidney stone disease. But what is the main that if we look to the all category, the aging population, so we have in many categories similar percentage when we can face to this problem. So kidney function. Really, kidney is the silent guardian of our systemic health. Can be spelling like a wet bed. So they can maintain the acid-base balance, water balance, electrolyte balance, toxic removal, blood pressure control, erythropoietin production, and vitamin D activation. I talked about it in previous lecture. But also, I already show you these slides that the kidney is the main organ which can express the protein. And protein, it's not only like mythological meaning of this, it's only like due to why this protein named by clota. But it's really a big fact that clota involved in the senescence process. And as the Dr. Makoto Kuroo and his team confirm the involvement the clota protein in aging process, so we can expect that the low level of clota protein can violate all these things in our body. But main action of clota protein that it can depress fibroblast growth factor 23. And if we are talking today about the kidney health, so for now, this factor accept as a more sensitive in kidney impairment. So if this is a marker can be even earlier than cystatin C. We know that we now calculate the GFR not on the creatinine level, better, more precisely to calculate by cystatin C, but this is marker even more early. Fibroblast growth factor can increase the absorption of phosphorus and excretion of calcium. This all together leads to the high level of phosphorus, so hyperphosphatemia, and this starts to many process, including the vascular calcification. As far as our calcium level decreased due to activation of fibroblast growth factor 23, it also additionally includes the many processes with the secondary hyperthyroidism. So clota inhibit these all factors, and normal level clota can protect some metabolic disorders which connect or reflect with the insulin signaling, protect the cardiac hypertrophy, vascular calcification, anti-cancer, anti-apoptotic, and even protect against neurodegenerative diseases like dementia and Alzheimer. But kidney failure symptoms are not specific. Sometimes patients experience some headache or swelling, poor appetite, vomiting. We can reflect the vomiting not special to kidney function disorders like insomnia, urine problem, easily fatigue, high blood pressure, low back pain. This is a general common complaints of our clients. But how we can reveal the kidney failure on the real fact, how we can confirm this? When we reveal the high level creatinine, cystatin, low GFR, some urine abnormalities, and high blood pressure, especially diastolic blood pressure. This is very common for kidney problem, which reflects on hypertension. And new option, it is fibroblast growth factor 23. If we talk about today about the kidney stone disease, so kidney stone disease symptoms also not so specific, can be stomach pain like back pain, this is more common, but vomiting, fever, dizziness can be general symptoms. Only maybe back pain and severe crucial pain can think about their kidney problem, even kidney stone disease. There are some theories of bone formation, but mainly this is a matrix theory. So for formation of stones need to be some matrix. And then if there's some causes still existing in our body, so this is matrix accumulate some crystals and leads to the stone formation. What are the main risk factors which can provoke the formation of this matrix? First of all, it's not adequate the consumption of water. It should be daily for healthy person without heart failure, 2.5 up to 3 liters per day. If we work or if we live in hot environments, we have to replenish our water in our body. Of course, urinary tract infection. And in first day was question about the gout reason. Also gout reason due to high level of uric acid, hyperuricemia, also induced formation of crystals, urine crystals in kidney. And today we will talk more about some reason for kidney stone disease like hypercalciuria, hyperoxalaturia, and hyperuricosuriia. Also, not only urinary tract infection can induce the activation of pro-inflammatory cytokine, also the general, or how we call the low-grade inflammation, can activate the special osteokine like osteopontin, which leads to the formation of matrix and bone stone formation. We always talk about the gut as a also main focusing of some our health general organs, all organs, brain, heart, and also the nephrolithiasis, because dysbiosis leads to the deplete amount of some bacteria like formidin, and these bacteria can activate the oxalaturia. So main causes of oxalaturia. Bearing in mind it's dietary factors. First of all involved our diet and lifestyle. So high oxalate intake. It's a food rich of oxalates such as spinach, beans, nuts, tea, and chocolate. And I need to emphasize low calcium intake. And of course gastrointestinal disorders. But what we should do if nuts includes as a healthy food in Mediterranean diet. How we can be between this positive and negative effect. So some research confirm that the almonds and pistachio good for gut microbiota and it's safe in part of prevention urolithiasis. And also, dysbiosis leads to the lack of Oxalobacter formigidins, and many trials confirm interrelation between low-level this good microbiome and urolithiasis. Second reason is calcium metabolism violation. So I have already mentioned that critical consumption of calcium daily is 400 milligram. This is only for our main functioning our organ like coagulation, muscle contraction, etc. So if we have less than 400 milligram daily calcium contained products or in supplements consumption, this activates some receptors because the calcium is crucial for many metabolisms. And this activates the secondary hyperthyroidism, which resorbs the bone because bone is the main depot for calcium. And we restore the calcium in our blood, but it leads to the bone resorption and accumulation of stones in kidney. So let's go through the main causes of calciuria. Dietary factors. So high dietary calcium intake also can be like reason. So we should be between the low level and very high level. Hyperparathyroidism, primary and secondary. Yesterday, I have shown about the case my patient with the primary hyperparathyroidism with the kidney stones, recurrent kidney stone, and some initial changes in bone mineral density. And after adenectomy, without any treatments, only surgical, all these parameters was improved. Renal cases. Also, renal hypercalciuria can be a condition like renal tubular acidosis, some endocrine and metabolic disorders. Some doctor not also severe focusing to the level of vitamin D consumption. In excessive vitamin D consumption, it can also lead to the kidney stones, and we should be between also, not so high, not so low, between in optimal level consumption. Bone disorders, some osteolytic disorders I also showed you yesterday in case women with osteoporosis and with myeloma, so it's osteolytic process, experience the calciemia and calciuria. Some medication. We also discussed about the reason of gout, that the thiazide diuretic can lead to the hyperuricemia. So lupus diuretic can also cause the calciuria and genetic disorders, and also immobilization. By the way, the immobilization can also cause the bone deterioration like osteoporosis. If you talk about the urologist recommendation, they are not restricted to some calcium consumption, only if in case if some reason for this, and I will talk today about it. But daily requirements for calcium is thousands to 100 for adult. And some publications have shown that the better to prevent the calcium, to prevent the kidney stone disease is consumption of calcium product compared with some supplements. What are the main causes of hyperuricemia? I already explained that it should be like two ways. First, it's a increase in the production, for example, seafood, meat, alcohol. it's high risk who likes beer consumption. Genetic predisposition, obesity, and also the kidney function. So chronic kidney disease leads to the decreasing the excretion of uric acid. And new risk factors, this is reflection with a bone condition. So nephrolithiasis is associated with osteoporosis, also in case inadequate calcium intake. We already talked about the osteoporosis, that is a silent epidemic, and I talk what does it mean, osteoporosis, what are the risk factors, and main and common factors is deficiency of calcium and vitamin D because it activates secondary hyperthyroidism, as well as the microbiome. And why microbiome can interrelated to these two conditions? Because in leaky gut condition, due to high level of pro-inflammatory cytokines that activate the bone resorption, so activity of osteoclasts, and leads to the bone resorption as well as the nephrolithiasis. So what we can advise? We can advise lifestyle modification with a very important normal consumption of water, urinary tract prophylactic, and prophylactic of metabolic disorders like hyperuricemia. Also maintain the level of calcium and don't worry about the kidney stone disease because this is a recommendation of European Association of Urology. So if we have hyperoxalaturia, that is why it is very important to advise our clients to do the 24 hours salt excretion test. So if we reveal the hyperoxalaturia, we have to recommend the calcium beta calcium citrate. If we have hypercalciuria, this is a very important point because in hypercalciuria, even if we have bone deterioration, we should not recommend continue consumption of calcium until we normalize the excretion. So for this purpose, the urologist recommend us the thiazide diuretic. This is main points when we cannot advise our patient to take the calcium supplements in case hypercalciuria. And I have already showed you our common work. This report was accepted as a poster presentation in SKO within 3 years, SKO Congress, because European Wellness, together with Bakomolets National Medical University and our Ukrainian Osteoporosis Association, continues the work about the interrelation between osteoporosis and nephrolithiasis. And we have some population, healthy population, which we pass through investigation of bone mineral density test, bone markers turnovers, as well as salt excretion. And because no any guidelines how we need to manage these two diseases together. We try to advise our clients with the osteopenia because on protocol of osteoporosis, we have to recommend some calcium supplementation and vitamin D. But in clients with a hypercalciuria, it leads to severe excretion of calcium in urine. Our 5 clients in this research were experienced these changes. That is why we now preparing some guidelines for this 2 pathology, which can help the physician to manage these 2 main diseases. Vitamin D. Of course, vitamin D, as I mentioned before, need to maintain in optimal level, not avoid the intoxication, avoid the deficiency and insufficiency. In case if we have the kidney problem or any reason for kidney problem with a GFR less than 60, we understand that the vitamin D cannot be converted to the D hormone, because only D hormone can bind with the D hormone receptors. That is why it cannot increase the absorption of calcium and leads to the secondary hyperthyroidism, where we have the low level calcium and high level parathyroid hormones. And it leads to two problems: vascular calcification and kidney stones. That is why in this case we need to advise active metabolite of vitamin D like alpha calcidol. Vitamin K2. As I mentioned before in my lectures, vitamin K2 still not included in official guidelines because lack of evidence base. But we know that the vitamin K2 is important to prevention of vascular calcification as well as the prevention of bone formation, kidney stone formation, because it's help to conversion glutamic to carboglutamic, and this is inhibit of vascular calcification mechanism. I would like to stop on the some types of vitamin K, because there are two types of vitamin K, K1 and K2. And very often we have some supplements with both vitamins. The vitamin K1 mostly derived from the leaf green plants, vitamin K2 from animal products and fermented food. Bearing in mind that vitamin K1 can increase coagulation, so it's should not be advisable for clients with a high cardiovascular risk. And I need to mention that recent research confirmed that seaweed consumption decrease the reason for secondary hyperthyroidism, prevents the vascular calcification and prevents the kidney stones, because by the digestive of fermented seaweeds, it's naturally produced K2. So no need to additional supplementation of K2, because it's natural improve our digestion and prevent the nephrolithiasis. And many clinical trials confirmed that vitamin K2 plus D can decrease the level of osteocalcin in urine and prevent kidney stones. That is why we have the own formula ImmuneVit with or Phytovit for Malaysia. It's a combination of vitamin D 5,000 units and K2 100 units. I talk about some reason for kidney stone disease, like inflammation, urinary tract infection, or general inflammation. That is why the polyphenols and antioxidants are very important in this prevention, as well as some herbal products which can prevent the urinary tract infection. And we have own formula, Swiss Nature brand, Kidney Health, with which contains the Jupirius, Solidago, Berberis, or Uva Ursi, which can prevent the urinary tract infection. And also how we can not keep silent about the clotho protein, because clotho is now main protein which help to increase our life, our time life, and our quality life. That is why many things which can maintain the level clotho, like renin-angiotensin aldosterone inhibitors. We have the proven results of losartan. Some other components, and including statins, recombinant protein, mesenchymal stem cells, and extracellular vesicles can maintain the level of clotho protein. By the way, if we talk about the bone rejuvenation, so many articles confirm that stem cell therapy can be useful for this purpose, and some research confirmed that mesenchymal stem cells can replace and rejuvenate the endothelial cells of basement membrane and injured tubular cells. But as I mentioned before, mesenchymal stem cells is a multipotent stem cells which can be matured only 5 stem cells. So it's good for prevention of bone resorption, but better to use the organ-specific stem cells, because we have some organ-specific stem cells like pre-endotheliocytes and pre-podocytes, which can be useful for kidney restoring function, as well as our peptides, mitochondrial peptides and non-organopeptides, which specific or organ-specific also, as well as the exosomes. You know that exosomes, it's act like the transmitter, the information between cells, and they carry active RNA. That is why the level of specific RNA can be also like diagnostic tools for early kidney impairment and kidney damage. But extraction of exosome from the mesenchymal stem cells have proved some improvement the kidney function. And this confirmed in many clinical trials, and we also have own product exosomes derived from mesenchymal stem cells. And this is our process of signing, and this is our common work, which we continue together with our colleague from University of Ukraine, Bogomolets Medical University, and together with the Ukrainian Osteoporosis Association. And we talk more about this problem in our article, which was accepted in Scopus journal, it's high indexes journal, and as well as our results of this common work were accepted in many SKO Congress, and even this SKO Congress 2025 in Rome. And we have published already common book. I talk about it, about the cardiac inflammation and strategies, the comprehensive approaches for cardiac longevity. So to take home message, I need to mention altogether there are many risk factors for kidney stone disease, for osteoporosis, but altogether when you can understand and can advise our clients, can prevent the development these two diseases like osteoporosis and nephrolithiasis. In conclusion, we have the range of our products which can be useful for treatment, for prevention of disease for our clients. Thank you for your attention.